Hi, everyone. Thank you so much for coming out tonight. So something I want to discuss tonight is the healthcare in the Department of Corrections in Arizona. The saying right now on social media is health is wealth, which is a very great attitude to have, but it isn't being applied to inmates, and it needs to be. Since 2013, the ACLU has been in a lawsuit against the Arizona Department of Corrections and Rehabilitation and Reentry due to their negligence with their healthcare system. This has been an ongoing issue. It was settled several years ago, and then in March of this year, the federal judge, Judge Silver, filed a motion to contempt on them, and it was granted due to their non-compliance over the last couple of years. They have not updated any of their statutes and the ways things are being done, and so it's continued to be an issue. And I think when we think of the prison system, we don't always think about their healthcare system, and I think that might be sometimes due to the way that the inmates are not held in the same regard as others, and that needs to change. In 2017, an inmate named Walter Jordan was diagnosed with skin cancer. He went to go see the doctor on call. I'm sure he wasn't an oncologist, but that's who he went to go see. The doctor told him that he should just go ahead and get the section on his head burned off to go ahead and get rid of the cancer. So he followed his directive and had an open wound in a prison that left space for tons of infections. He went to go see a different doctor, or went to go see the doctor at another time, which just happened to be another doctor. And he said that radiation would have been the route that he would have gone. But at that point, it was too late. And several weeks later, he had already passed due to the advance of the cancer and the infection that happened due to the the malpractice. Honestly, the medical care was not what it needed to be. And if he was not in prison, then he would not have received that information. And I think many may have just passed under of, that's where he was and this is what happened. But unfortunately, not unfortunately, but he is a person. He was a person. He was a dad. His daughter was with him for his last breaths. And she shouldn't have had to have her dad pass that quickly or in that way. Inmates are people too, and they deserve respect and they deserve adequate health care. And as we discuss criminal justice reform, we have to discuss their health care in prison and coming out. When we look at repeat offenders, when someone goes into prison and they're diagnosed with something or they're able to get on their medication, they're able to get it consistently while they're there. Then they come out of prison and they don't have the same access to health care. So then they're off their meds. And for some, it might be something minor for you know, some sort of heartburn issue or heart issues. But for others, it might be something due to a mental illness, and so they need that medication to regulate them. And when they come out of prison and they don't have that same medication, it can lead to repeat offenses. So I think that healthcare needs to be a continued discussion when we look at criminal justice reform. So as we go through the night and we're looking at our blocks, keep that in mind when you're carrying around your block and the ones that you have and what that means for you. Thank you.